Thank you for staying with us. A bill to prevent medical doctors and dental practitioners from being granted full license until they have worked for a minimum of 5 years has passed second reading in the House of Representatives. The bill is sponsored by Lagos lawyer Ganiu Johnson and seeks to mandate any Nigerian trained medical or dental practitioner to acquire not less than 5 years' experience on the job before being certified to be on their own. Though some members rose against the bill, describing it as a form of slavery, the sponsor insists it will curb brain drain and make quality health services available to Nigerians.
Dental practitioner to practice in Nigeria for a minimum of 5 years before granted a full license by the council in order to make quality health services available to Nigeria.
But here in Nigeria, the government is investing so much money and at a subsidized rate. We can make it a bit flexible by putting an option. For example, rather than saying you should not be granted a license, we can say anybody who wants to leave before 5 years, he should refund the government of Nigeria the money that was used in training him.
Well, joining us on the news is a medical doctor, Chinasa Amadi. Thank you for joining us. Now, there's been divergent reaction to this matter from a majority of Nigerians who are not practitioners. Now, you are in the field. I wonder what your impression was when you heard this news.
Thank you so much first for having me. I think I had a mixed reaction. In the sense, more like I want to know more about this bill. Like there has to be more, because if you say a lot of doctors, even from school outside, come back home to take the certifying exams before certifying. So are you saying that a doctor will have to do housemanship for 5 years because you need the full license to be able to do youth service? You need a full license to be able to do residency. So does it mean that we will have to do 5 years of housemanship before getting a full practicing license? These are questions that are coming up. And I think it's also a situation of addressing the symptom of a disease instead of addressing the cause of the disease. What is the cause of the brain drain first? That is what should be addressed, not taking care of symptoms of a condition when the cause is still there. Once the cause is still there, the problem will still exist. So first of all, there needs to be a reform in the health sector. That is what we need. And that is what will now stop or maybe abate or reduce the brain drain that we're seeing right now. So I think that, first of all, we need to know the full details of this bill and what other clauses are attached to it. And then they need to be thinking about the cost. I think better situations will be, coming up with bills that pretty much will curb seeking medical help outside. Because when government or the other, civil servants are not seeking help outside, seeking medical help outside, checking their blood pressure outside, and wanting to do it here, it will impact on the health sector directly. That should be the focus, not the stopping the doctors. What of the nurses? What of the lab technicians? What of other health professionals? I think there's a lot more we need to know about this before coming to, but the initial reaction is like, no, it's not possible.
All right, brain drain issue is on the one hand. Then on the other hand is the matter of professionalism, where they are saying that it will address the matter of professionalism in the system. What do you say to this aspect?
It's important, first of all, to know that most doctors, you can't practice unsupervised without a full license. So professionalism in what sense? Is it being a doctor or being an unsupervised doctor? That means you're able to practice without being supervised. That limit, if you're not given a full, we currently can't practice unsupervised without a full license. So if you need specialists, as you need to have a full license to be able to even go into a residency program to become a specialist. So we're just going to be having a herd of or maybe not specialized doctors yet, because you're trying to keep them for that 5 years gap before they get a permanent license. I don't know. It doesn't balance out.
I'm believing that in the coming days, there will be more light with regards to the content of what the members are asking or talking about with regards to this matter. But we will be leaving the conversation here now for want of time. Medical Dr. Chinasa Amadi, thank you for your time on the news.
Thank you so much.